Hi everybody, welcome to Susie Speaks. Today I want to talk to you about mental health issues. I want to give you some statistics before we start. Suicide is the 10th leading cause of death in the United States. On average, there are 132 suicides per day. The highest suicide rate is among white middle-aged men. As of April 14th, 2020, suicide hotlines have seen an increase of 800% in calls during this pandemic and lockdown. And in March, the lockdowns, crime fell by 25%. Domestic violence increased by 5%. The UN Population Fund suggests that 3 months of quarantine will result in 20% rise in intimate partner violence throughout the world, and a total 15 million additional cases as a result of lockdown. By the end of March, there was a 22% increase in monthly calls to RAIN, which is Rape, Abuse, Incest National Network. 67% ID'd their perpetrator as a family member. 79% of these people said that they were living with their perpetrator. Stephanie. Everybody, this is Stephanie Herren, and she is the leader of mental health advocacy in Randolph County. Thank you for joining me today, Stephanie.
You're welcome. You're welcome.
Mental health, domestic violence, and child abuse they're very close subjects to me. They matter a lot. And I know you as an advocate are very aware of the issues that we face in this county.
I am.
What do you think the biggest challenges to obtaining mental health treatment are in this county?
We have limited resources.
Mm-hmm.
They're not easily available to consumers. We have one mental health treatment facility here, and it's very hard to get an appointment. It's income-based. You know, people really can't afford to go and pay a therapist, $50 an hour, $75 an hour, They have an indigent drug program, which is, that's necessary,
Mm-hmm.
If you're going to have a mental health program, because so many times they will not even see you at a treatment facility unless you're medicated.
Right.
That's a requirement. You have to start your medication. We are supposed to have a crisis intervention team at that place, but I have never experienced that.
Mm-hmm.
You get a lot of promises from them. As far as in Randolph County, they made a lot of promises when they switched companies. It was kind of a smaller company, and then they went to a bigger chain.
Mm-hmm.
And a lot of their therapists now are teledoctors.
Mm-hmm.
You talk to them, and that takes some personality away from it. But we have one. Even in a mental health crisis, you're not going to get an appointment right away.
Right.
Which that's scary.
Mm-hmm.
Because we have a high rate of drug use here. We have a high suicide rate. It's a poor county, limited resources. I mean, it's just the perfect storm for people to continue to suffer and
Mm-hmm.
never get help.
Right, and I imagine during this pandemic and lockdown, the problem has only been exacerbated.
Mm-hmm.
Ugh, I can't talk.
Mm-hmm.
It has only increased.
It has.
Mm-hmm.
Like you were talking about domestic violence. I see that as a big problem. Here, I mean, if your husband's got you at home you know, or wife, you know, and they're controlling you, and you know, they're making sure you're isolated from society, you know, pulling you away from everyone else so you don't have any interaction, you know. I mean, that's part of what they do anyway, you know, to make you feel powerless. But when it is ordered by the state and the State Department of Health that you have to stay at home, I mean, you know, that's just the perpetrator's, you know, biggest
dream.
Well, yeah, it really is. You know, I mean, that's all they live for.
Right.
You know, it's like a dream come true to be able to have your victim there, and they can't leave by order of the health department.
Right.
You know, and it's just it's sad, and it has increased here. I have an accountability group, and a lot of people talk to me about stuff like that. And I had a lady on there, and that was one of the first things she said is, "Oh no, you know, I'm going to be locked in the house with this person that's doing these things to me, and there's nothing I can do about it." And she was right. You know, you are.
Right.
And I have seen, I've been sent pictures, you know, where women have been physically abused at home. But what do you do?
Right.
You know, well, I mean, what do you do? Because yes, you know, you can report it to law enforcement, but you know, they're not really going to want to bring anybody new into the jail because of the pandemic. So they kind of, you know, move away from that. Women's shelters, I mean, they're always full. You know, I mean, you can never have enough women.
And on top of
shelters.
that, here in this county, I think that the domestic violence services are out of Birmingham. And there's no access to get for a woman who is in a state of panic to get there.
No, there's not. The county does receive some funding for battered women, but it comes from another county. You know, they oversee it. And I don't really think a lot of it actually filters down into Randolph County where it needs it. But the reason being for that is because it is so underreported.
Right.
You know, you can't really throw money at a battered women's shelter, you know, or a safe house if you don't have the statistics to support that.
Right.
And you know, it's a shame, you know, people won't report it. You know, they're scared because what are you going to do? You know, you're going to report it. There's nothing going to be done. You're going to come back and get the hell beat out of you again. So why even say anything?
Right.
It's a vicious cycle, but you know, it's the way it is in rural counties, especially, you know, in Randolph County.
Right. So what do you think needs to happen for the citizens of Randolph County to have access to better mental health care?
Well, I've talked about this with our representative before, Bob Fincher, and I give him some ideas. And my ideas, they come from a model in Carroll County, Georgia, where I work there with Carroll County Mental Health Advocacy over there in Carroll County. Their probate judge is really, well, she's a godsend, you know, to a lot of people. She's over the program. She doesn't ask people, "I need your help." She just appoints people. So with her position as a probate judge, you know, in the court, she has a lot of say-so, you know, if somebody does go to you know, a home or whatever. But here, we don't have that kind of resources, you know. So that's where I do most of my work, is in another county, because they, the stigma there is not as bad as it is here in Randolph County. I try to tell everybody, and I've done classes here, and we have trained probably 150 people on mental health first aid. Anywhere from, you know, members of law enforcement, teachers, you know, we've trained a lot of teachers at Randolph County schools. And so I try to offer free programs, you know, for anything that they want here. But as far as, you know, if you had to pay for something, you know, we just don't have the resources. But then that goes back to my conversation, you know, with our state representative. You can't really justify throwing more money in a county for that if you're not reporting the statistics.
Right.
And saying this is a big need here. When in actuality, I mean, you know, nationally, we know that 1 in 5 people are affected by mental illness.
Right.
You know, we got what, 20-something thousand people in the county. That's a lot of people that are going untreated for mental illness here.
And do you think that that's why there's such a drug issue here?
I do.
People self-medicate.
I have always said that. Always said that. You know, you need a prescription. You know, you can't get one easily. You can't even get an appointment to talk to somebody about getting a prescription. So what do? You self-medicate.
Right.
You know, we're a wet county now.
Mm-hmm.
Alcohol is really not a big issue for females, I've noticed, but in the male population, it is a really, really, really big issue. That's how they self-medicate. Females, on the other hand, you know, they're going to use straight drugs,
Mm-hmm.
and they're going to trade sex for straight drugs, you know, because they don't have jobs,
Right.
you know, and then this becomes a vicious cycle, you know, because then not only do you have a mentally ill person, you also have an addict now.
Right.
And, you know, they lose their kids,
Mm-hmm.
you know, and then you get the, you know, DHR involved, you know, and sometimes people don't even know what happens to the kids, you know,
Right.
I mean, but when you're down, you know, as a female, you get to the point you can't worry about that anymore, you know,
Mhm.
and so then you have to consume more straight drugs to make you feel better.
Right.
You know, it's a lot. It's a lot. I'm gonna say probably 80% of the people here in Randolph County that have a drug problem have an underlying, untreated, undiagnosed mental health condition.
That's what I
Mm-hmm.
had thought as well.
Yeah, and that's just from talking to people.
Mm-hmm.
That's not any kind of, you know, research or anything that I've done. It's just knowing people. And I mean, when, you know, somebody messages me and says, I've got this, and this going on, I mean, it's just textbook. You know what the next thing is.
Mm-hmm.
You know, I need to get my son help because he has a drug problem. Okay. I need to get my daughter some help because, you know, she's, I don't even know where she's at. I'm afraid she's going to, you know, be found
Mhm.
dead. Okay. Do they have they ever had some sort of mental illness? And the most common answer I get is, well, I think they do because, you know, they've always had something wrong since they were kids.
Mm-hmm.
And, you know, anxiety, now this is actual statistics, nationwide statistics. You know, children start suffering from anxiety about 10 or 11 years old.
Mm-hmm.
If we're not paying attention to that, we have adults with anxiety.
Right.
And then we have adults that are self-medicating because we have lack of services. So it's a vicious cycle. You know, I mean, you can look at the jail, you know, the jail roster. Possession of a controlled substance, marijuana. You know, very rarely are you going to have distribution,
Mm-hmm.
a charge, because it's misdemeanor charges. And then you're in the jail, and then you're in the system, which exuberates what, you know, having a mental illness to start with.
Right.
Because they're not properly trained to deal with individuals that have mental illness. You get there and you're stuck. And it's just
Mhm.
like you know, it's a snowball effect.
And I think too, that's probably most of the people up there
Mm-hmm.
at the jail. I mean, you've got people in there that are habitual violators, you know, with drug issues, and you also have people who are in there, you know, for violence against others, and a lot of that stems from mental health issues that have not been addressed.
It does. You can't just go to your probate judge and say, you know, I need some help for my daughter. I need some help for my son. The waiting list is just, I mean, it's just,
Right.
it's terrible. If they commit a crime, you know, you're going to go to jail. And that's how they're going to deal with them. They're going to remove them from your home, but they're going to be taken into a facility that is not adequately trained to take care of their needs.
Right.
We have a pretty good lady that works here in the county, and if I know somebody that has, went to jail, I'll kind of just give her a call and I'll say, look, such and such needs an evaluation,
Mm-hmm.
But that shouldn't be something I'm asking for.
Right.
It should be mandatory.
Yeah.
But it's not. And it is sad. It's really sad. Then once they get in there, it's a very unforgiving system.
Mm-hmm.
In the county I work for, as a mental health advocate, they have a pretrial diversion program,
Mm-hmm.
and it's an amazing model. You go to jail, and whether it be domestic violence or criminal mischief, you go to jail, and you get assigned a mental health advocate.
Mm-hmm.
It is one person that follows you through a 12-month program, so you don't keep these charges on your record, And the advocates are very well trained, You never know what kind of patient you're going to get when you sign up for that program. I've had, anywhere from, anxiety to schizophrenia.
Mm-hmm.
And you just never know. But you take it, and sometimes you're the only person that is an advocate because the family's tired.
Right.
They've had generations of dealing with this person. They just want them in jail. They just want to be away from them.
Right.
And it's a very successful program, and it doesn't make you a criminal just because you're a mental, you have a mental condition, a mental patient. So I really like that program there, but it's not here.
Right.
And if I had one wish, for Randolph County, of course, there's other things that I want, but the main thing would be, just get people some help.
I think, the jail's always at maximum capacity
Mhm.
until we get this new facility open.
Mm-hmm.
At what point do you think that there should be some evaluative process for these people to be identified as potentially having problems so they don't grow up to self-medicate or criminally mischief, habitual violators?
Mm-hmm.
At what point do you think that just everybody should be evaluated for some mental health?
Elementary school.
Mm-hmm. Yeah.
Elementary school. And we should have people that really know what to look for. Anxiety is going to mirror ADHD. Everybody wants to talk about Ritalin, pushing
Mm-hmm.
Ritalin, keeping these kids calm down. I would like to go a step further with that and see why this kid is acting out when they get to school.
Mm-hmm.
Maybe that's the only place they feel safe.
Right.
Maybe they're crying for help. They usually are.
Mm-hmm.
They usually are. And, DHR could be very helpful in helping with that if they would, and not hold it against the parents, And if everybody would stop the stigma, we could really have a good conversation,
Mm-hmm.
about this, because, you can just go out on the street and, you see 5 people, one of them's going to be affected by mental illness, whether it be them
Right.
or their family. And, with the pandemic going on, it's made the situation much worse because, if you're mentally ill, you need a schedule. You need something that you can know is going to happen every day because you don't know what's going to happen with you every day.
Right.
You need something that's
Consistent and safe.
And safe. That's exactly right. So I don't know if we'll ever get to where I would be happy with mental health services here, because I'm such a, I guess a advocate for that. I just don't think that we will ever get there in my lifetime, but I still try.
Do you think that, the system being broken as it is, if we maybe switch focus and maybe focused on the children and giving them mentors and, You know, having people in their lives that are safe, that they can count on, and who will guide them into a healthy life, education, a life plan. Do you think that it would ward off some of this potential, you know, truly mental health issues in the future?
It could,
Mm-hmm.
but you would have to treat the whole family
Right.
because you have generations of untreated mental illness here. And people don't realize it is actually a mental illness that, you know, that they're dealing with. They just think, you know, I have rocky relationships, I can't keep a job, you know, I want to stay drunk all weekend. You know, they don't really realize why,
Right.
you know. So I think, you know, yes, identifying the kids in school that are, you know, I mean, you'll know them, you know.
Right.
I mean, you know, in your work, you'll know a child just
Mhm.
by listening to them, you know.
Right.
And but you also have to go a step further and see the parents,
Mm-hmm.
you know, because a lot of times I even had one person to write me in my group and said, you know, my son, you know, has some mental disorder. I don't know what it is, but my husband says he's possessed and he's going to cut his head off. So then, you know, that happens, you know, because people don't understand mental illness.
Right.
You know, I mean, the dad actually threatened to put the boy's head on a stump and chop it off because he wasn't going to have that crazy shit, is what he says, that crazy shit. You know, that will be the kind of people that you're going to have to educate as well.
Right.
You know, your child's not possessed. He has some kind of chemical imbalance or some kind of environmental issue that has caused these issues with him.
Mm-hmm.
You know, but here, you know, it's very religious, you know, and everything people think, take them to church, take them to church. That doesn't work.
No.
I mean, it's proven it doesn't work.
Right. And on top of that too, you see, you know, these people, these pastors and church workers actually abusing the children that are members there.
Exactly, which makes another mental issue
Right.
come about.
Right.
Yeah, and a child that already has anxiety, that already doesn't fit in, you know, they're easy targets for child molesters, you know, in the churches, in the schools. I mean, you know.
Yeah.
You know, I mean, they're easy targets because they want to fit in. Okay,
Mhm.
you already have a child that has anxiety, that may be abused at home. They find somebody that's nice to them. They need that. That's the easy way to get their, you know, to gain their confidence. And then all of a sudden, you know, 5 years later, you have a child that's been sexually abused for 5 years, and then you have another mental issue to add to that, you know, a personality disorder, you know. So, I mean, you're going to have to treat the whole family, you know, but you've got to start somewhere. You know, maybe you
Right.
could change in that child something that wasn't changed in their parents. But, I mean, it's sad.
Yeah.
It is very sad. I would like to say, yes, let's start talking to our kids about this, but you're going to have a whole generation of parents that are going to blame you,
Right.
you know, for saying something that actually doesn't exist. Like, some people don't even think mental illness exists.
Right.
So you've got to educate the whole family unit.
Right.
Um,
And two, I mean, that's one reason why I wanted to start this dialogue about this issue, because truly it is a lot of the basis for all of our social problems. You know, child abuse, neglect, human trafficking, prostitution, you know, criminal behavior, and it's the basis of all of it. It's just not being mentally healthy.
I agree.
And, you know, what I wish is that people in the community that had some financial resources or even just time would realize that if you want a positive change in your community, you want your jails to empty, you want people to be happier and healthier, not all the robberies going on to support drug habits and all the drug paraphernalia at our playgrounds, etc., 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 that you have to start with the basic foundation of mental health. And if they got behind mental health issues, you wouldn't have to put forth all the money and all the crime and all the headache that goes with all the rest of it.
You're right. I mean, it's not just Randolph County. I mean, it's
No, it's-
nationwide. You know, the number one treatment facility for the mentally ill is jails.
Right.
And that's no treatment facility at all.
No.
You know, we used to have mental hospitals.
Mm-hmm.
Yeah, you know, they were bad. But when they closed them down, what did they offer as a solution? Nothing.
No.
So that's when you have jails that emerged as being the number one housing facility. It's not a treatment facility by any means.
No.
Because, you're going to go in there, okay, you have anxiety. You have social anxiety. Well, they're going to put you,
in a cage
in population.
with a whole bunch
maybe
of other
4 or
people.
5 more people. Okay,
Mhm.
that just makes it worse. Okay, you have anxiety, just general anxiety. Noise, from a jail. That's going to make you worse. You're going to act up. You're going to tear up stuff in jail. You're going to catch more charges. Destruction of public property.
And on top of that, a lot of these people who are already kind of victims anyway get in there and get re-victimized by the other inmates that have other mental issues.
Yeah. It's a big society problem. It
Mhm.
really is. People just only started talking about it maybe in the last 4 or 5 years, I guess. But it's something that, I've always, known about, suicide and family,
Mhm.
Homicide, murder, all those things. When they happen in a family, you try to figure out why, and you could be 40 years old and your whole family be crazy and you never even knew that it was because of mental illness.
Right.
Because this is just something you're not going to talk about. You're just not going to talk about this.
Right.
It's just not possible. So it's a big problem in society. I can only imagine when the numbers come out after the pandemic, what it's going to show as far as suicide rates. Because, your statistics are right. It's about every 14 minutes that somebody commits suicide in the United States.
Mhm.
And then every 15 minutes somebody wonders why.
Right.
They blame themselves. It's a ripple effect. In our studies, statistics tells us that one suicide in a family affects 100 years.
Right.
Because, they remember.
Mhm.
You have a daughter that commits suicide, and I'm not supposed to say commit suicide. So dies by suicide. That affects her mother.
Mhm.
Maybe she had children, that affects her children. So you can easily see where it would affect
Generations.
100 years of
Mhm.
a period of time.
Right.
It's a ripple effect. And like I say, it's something that we really need to talk about more, but it's very painful to talk about.
And I think too, with a lot of the distractions that we have in our society, we have our technology, we have our phones, and people are losing the ability to communicate with others anyway because of this technology that we all have now.
You're right.
And it's only making profound problems worse because people don't have the ability to communicate anymore with each other.
Right. And just think about wearing a face mask.
Right.
That totally makes someone not personal.
Yeah, it
It
dehumanizes
does.
people.
You're right. That's the good word. Dehumanizes them. Because when you have a conversation with somebody, you look at their eyes, you look at their mouth, you see if they're smiling or not. But if you're looking at a mask, you can see none of those things.
Right. And it takes away your voice.
It takes away your voice. And so does texting someone.
Right.
People don't talk to each other anymore over the phone. You can pick up a lot about how somebody says something, or you're not going to pick it up, on a text message. People are really scared to talk about suicide. Like, you wouldn't believe the people through our training that even question the training that says point blank ask somebody, are you suicidal?
Right.
They're just
Very uncomfortable.
They're very uncomfortable with that. But I can promise you're not going to put that idea in their head.
No.
Because they've had it. So go ahead and say it.
Right. And I have noticed too that if someone truly has had suicidal ideations, that whenever something goes sideways in their life, that's the first thing that pops in their mind as a solution to their problems. And suicide is a permanent solution to a temporary problem.
It's terminal.
Yeah,
I mean, it's just the same as cancer.
right.
I mean, you have cancer, you're gonna die at the end, okay? You have mental illness, you don't get treatment, you're gonna die by suicide.
Right.
I mean, mental illness, suicide is the terminal part of mental illness.
And it's hard to ask for help.
It
It takes strength of character, and but it also shows that a kind of a determination to live in spite of your mental problem.
Do you know what the number one thing people say that have contemplated suicide but have not done it, or have attempted and not completed? They just want somebody to ask if they're okay.
Yeah.
They just want somebody to listen. They don't want you to fix their problems.
Right.
Just sit there in the dark till they find their light. That's sometimes all you have to do.
Right.
You don't have to try to analyze them. You don't have to try to, get them put in a hospital. You don't have to call the police. Sometimes, when you're standing on that bridge about to jump and there's 50 cars coming down it, all it would take is one person to get out and say, "Is everything okay?"
Yeah.
And it would be a release, that somebody actually cared. Even if it's a stranger, it doesn't really matter.
No.
And sometimes it's better to talk to a stranger if you're having problems, because you're not judgmental.
Right.
And that's a big issue, is being so judgmental.
And
to
two,
people.
I have found, in my work too, that I have found that people actually would rather talk to someone because their family members, their friends, their loved ones, they're too invested. And, and a lot of times, they say, well, I love you and so loves you, and what do you have to be depressed about, or what do you have to be wanting to die for? You have a great life. And that is the last thing that people really want to hear.
It's insult to injury.
It is.
It really is. This is what I tell everybody. My friends, anybody that I come in contact with while I'm, working through the advocacy program. Nobody, if I say, "Suzanne, that really hurt my feelings," you don't have the right to say it didn't.
Right.
That's my right.
Right.
And that's what I try to tell everybody. Okay, your mom hurt your feelings. Well, that's your feeling. You own that. At no point in time does she have the right to say she didn't.
Right. Because it's how you feel.
It's how you feel, and it's justified, and it's how you feel. And I just wish people would stop trying to take the power away from someone that says that by saying, "No, I didn't." You don't have that power to do that to people. Your feelings are justified.
Right. And I noticed a lot in working with people who are mentally ill too. It's a problem about taking personal responsibility too, not owning how you feel, and the people who are in your life and surrounding you, a lot of times, well, you wouldn't feel that way if you did X, Y, and Z. And they won't take responsibility for their own shit, that they are doing to someone else. And the person who is victimized and having issues won't take personal responsibility for their feelings, and there's a breakdown of communication. And if more people would respect each other, and more people would take personal responsibility, I mean, that would be a good start.
It really would be.
But it seems like everybody wants to pass the buck. And unfortunately, that's not a very healthy thing to do.
Well, I mean, look, if you have to talk about somebody else's mental issue, you might have to think about your own.
Right.
And that's very uncomfortable for a lot of people.
Mm-hmm.
I mean, you know, your granddad said home drunk. You know, that's just history, you know. But, you know, when granddad passes away and then the grandson becomes the town drunk, you probably need to figure out what's going on there. There's a problem. And it's not just that your granddad liked the moonshine, or, you know, he liked the booze, or he liked the whiskey, or, you know, whatever, the vodka. It's that he was probably feeling really shitty about something and didn't know why, didn't have access to mental health care, didn't have access to medications and therapy, but he did have access to the bootlegger down the road.
Right.
And, you know, after a pint,
the problems just don't seem to be as big anymore.
they really don't. But then, you know, with that comes, then you've got an alcoholic grandfather that's going to come in, that's going to rage up on you, you know, that's going to probably destroy property, that's going to destroy feelings, you know, has no disregard for what they say or do. And, you know, then that passes down the next generation. You know, and so maybe, you know, the grandson saw that.
Right.
You know, and he just can't quite figure out why he doesn't feel good about that. So then he's just going to drink too.
Right.
I mean, it's generational.
Yeah.
You got to treat the whole family.
Yeah.
That's my belief.
Yeah. And two, I have noticed, you know, with my friends and colleagues and people in the mental health issue that are providers, a lot of them were also people who were suffering from mental disease, and the reason why they got into advocacy or became a therapist or studied psychology is to deal with their own personal demons. And those people, in my opinion, make the best advocates for people, because they've been there and they have wrestled with their demons and fought with them and have come to some realizations, and they do good to help other people with theirs.
Those are the best counselors.
People that are
peer, you know, peer specialists, that's what they're called. And they let you do that for a reason. You know, it's real life stuff that makes you the best educator on stuff like that. You can learn it from a book, you know, you can learn it from a classroom. But you know, a year, if people just would even live 1 year with mental illness, you would be able to teach everybody, you know, episodes of mania. You know, I mean, you never know in the morning when you're gonna, you know, what you're gonna face. People used to call it split personality. You know, I mean, that's very rare, very, very rare. Okay. But you do have borderline personality, and you have other personality disorders that would kind of mimic that. You know, but split personality is what you see in the movies. You know,
Dr. Jekyll, Mr. Hyde.
Right, right. I don't guess it's impossible, but it's very rare. We're eventually, you know, we're getting to where we have different diagnoses for stuff. I mean, there's new, you know, mental illnesses that they're coming up with
Every day.
Every day, you know. That comes through research. You know, that comes from talking to people that have real life problems. You know, you might be 40 years old and you never realize that, you know, I have a mental illness. That explains why my life is so screwed up. That explains why I have made such bad decisions, you know. You just think it's a character flaw.
Right.
You grow up thinking it's a character flaw. When, no, it's something more than that. You know, it could be a mineral deficiency, you know. thyroid issues,
Mhm.
you know.
And hormonal issues.
Exactly.
Especially, in our time of life too. I mean, in men, middle-aged men, having the highest suicide rate. I mean, it's the hormones that are causing a lot of the problems. Not all of them naturally, but that just sudden drop of what used to be there, it messes with your mind.
It does. And, there's a high rate of men simply because they're not going to talk about mental illness.
No. Mm-mm.
They're not going to talk with their buddies, their pals about it, They might get at a party and get drunk and just totally show their ass, But if you've ever been there, you're going to recognize it. That's just, that's just what you do. But they're not going to talk about it with anybody else like women. Like women, we'll talk to each other to a certain point till we not like each other anymore, and then we're mad.
Yeah.
But men are not going to do that. They're not going to share about their feelings. And that's why you have got, such a high population of our men dying. And, and it's white and black too. It's non-discriminatory. It's just that age bracket. You grow up, you have to get a job. You have to provide your family. Humans are not created or designed to take the amount of stress that we have to take in today's society. They're not.
Right.
And I think that's what happens to men. There's so much pressure on them to be the provider, to be the breadwinner, to be the protector, and all these things, and when you live in a small town, you have a reputation to uphold. You have to be like your granddaddy, that has this and a farmer and successful. And a lot of times when people get to that age bracket there you were talking about, they feel like they're let down because they haven't accomplished as much as society or the community tells them they should. And the easiest way out is just suicide.
Right.
Which is actually easy for them because
hard.
it stops the pain.
Right.
And people that, die by suicide, they don't want to die. I will never believe they want to die. They just want to stop their pain.
Right.
And that's the only way.
Yeah.
And plus, men own a lot of firearms.
And that's their favorite choice of
that's their hobby.
dispatchment.
It is. And that's mostly, how they do that.
Right.
Occasionally, it'll be by hanging. But mostly it's by firearms because they have an easy access to those firearms. When they get to be in the 21 age bracket, they have easy access to alcohol. Okay, you mix depression, alcohol, and firearms, it's a bad situation.
It's a recipe for disaster.
It is.
And on top of that too, with all these movements that are presently going on, men are being chastised just for simply being a male. And they are, with this Me Too movement, there are a lot of times that they're just victimized just by their gender.
I agree.
And that's unfair. But then again, that comes back to women's mental health. They're just trying to get some of their own back after millennia of being, victimized.
Yeah. And it's the age people marry. You marry, okay? And whatever problem the female brings into the relationship, the male brings his own problems into the relationship. It's turmoil. It's a battle for control. You have a lot of narcissists, that like to control their spouse, their partner. I would say men, are most in that category, but then the women are manipulators. They manipulate the men. They keep their emotions messed up,
Very passive aggressive, a lot of them.
Exactly. That's exactly right. You never know if your supper's tasting fine because it's just cooked with good ingredients or it has decon in it because she's sick of you. You just never know.
Right.
And I think men have a reason to be scared of women for that because we're very conniving, creatures.
And women's favorite choice of murder is historically poison.
Yeah, because we don't like to see a mess.
Right.
We
don't want to have something else to clean up.
Exactly. Even in the end, you don't want to have to walk in and clean that up. You want it to be clean. You want it to be done with and out of your mind.
Right, and so you can move on to whatever else that you want to do.
There was a guy, this is a funny story. He told me this other day, he was like, he was like, we was at the chicken house and we were putting out poison, for the rats. Because, of course, you have a lot of rats at the chicken house, and we have a lot of chicken farms here in the county. And he was like, a few of the men were around, and they had a company out there that did that. They would come and put the bait stations up in the houses. And one of the guys that was helping him, he was like, that smells just like my coffee. And come to find out, his wife was poisoning his coffee every morning with rat poison.
Oh.
This happened right here in this county.
Wow.
Mhm.
Wow.
So you're right.
Mhm.
It's easy. You think nobody will figure it out. And right now, you could basically kill anybody you wanted to. It would be COVID-19.
Right. It would be.
You talk about it's a perfect opportunity for spouses to keep their significant other trapped at home for abuse. Equally, it's it's possible to actually kill somebody, and get away with it because it's COVID-19.
Right.
It's let's just hope they all make it.
Well, right. The whole point, doing this is to bring awareness to mental health, but also to make people aware that this is a very crucial time and it's a very critical time. And just please be aware and supportive of people out, your neighbors, your friends, the kids down the street. Watch, look, and listen, and be a friend. Be kind to each other.
Exactly. That's exactly right. The fallout. There will be a mental health fallout from the pandemic, and statistics are not in right now. They probably won't be in for years. But it's just like the effects. It's just like the war in Vietnam. It won't be the war that kills you.
No, it'll be Agent Orange.
It'll be the Agent Orange,
right,
which is the fallout from war.
Right.
So yeah, we're going to be facing a mental health fallout because of the pandemic.
I agree. And
people need to up their game and realize it. It's they're going to be one of the silent victims. I do believe.
Stephanie, in closing, is there anything that you want to tell the people?
I guess it's the same advice that I would give anybody, a friend of mine. If you feel like something's not right, talk to somebody, whether it's a stranger, if you have a friend that you're comfortable talking to. You have your own feelings. You're entitled to them. Nobody can tell you not to feel a certain way. There is help. You may have to look a little hard to find it, but there are people out there that will help you find your light, and just don't give up.
Right.
Don't think that suicide is the only choice you have, because it's not. Living's going to be painful for a long time until you figure this out. But when you do, and you become self-aware of your mental illness, and you study it, and you research it, and you know the symptoms, you know the causes, and you know the treatments, being self-aware is it's a stage that's hard to get to. But you can get there.
Right.
I'm living proof you can get there.
Right. And for those of you who need help, I will be posting numbers to the helplines. It's not okay not to be heard if you are being victimized. It is not okay to have someone hurt you. It is not your fault, and there are ways for you to get help. As for now, this episode's over, and this is Susie and Stephanie. Y'all have a good day, and y'all stay safe out there.